it's equally important to communicate both with the patient and the relatives. To communicate with the patient, particularly if the patient is reasonably intelligent, is extremely important, because you then make him an ally in your fight against this problem. That's extremely important. One reason. The second reason is you increase the doctor-patient bond, the doctor-patient trust. The patient feels that he is going to get better. This doctor is telling me what is happening. I know exactly what he's doing, what is happening. Everything I'm aware of. The trust that occurs in such a situation, in my opinion, is one important aspect in the healing of the patient. Because the mind, particularly in a seriously ill patient, is extremely important to tilt the balance between life and death. There is a patient who says, who feels within himself, I'm going to die, I know I'm going to die, you probably will die. But if you have the courage to say, no, I might live, and if that courage can be helped by the doctor who is looking after the patient, it makes a big difference. And I would suggest also one other thing to some of the doctors here, that not only do you communicate with the patient, with the relatives, but you communicate with yourself. And the best way I communicate with myself is that, not in every patient, but in patients who have been very troubled with, whom I'm not sure of what is happening. Every 5 to 7 days, I write out in the case sheet a full description of what has been happening, what I have done, why I have done this, and why I have not done this. What do I anticipate, and what am I taking? What precautions am I going to take? It sometimes happens that whilst writing this, suddenly a flash comes across, oh, I think I missed this point completely. And sometimes, you know, you really get onto the right track when you've not been on the right track.
So the good thing about Dr. Farooq Udwadia giving a second opinion to Dr. Farooq Udwadia is that he knows that he's getting the second opinion from the right person. Unfortunately, a lot of us don't have that ability. Dr. Sunil Pandya, you run a department. Now, you know, no matter how conscientious you may be, you know, you have residents who come in, and you can't pick and choose whom you get. And then what happens if you find someone perhaps who you don't think is doing a good job or is cutting corners or is not? How do you manage that? Because I think